Good morning, everyone. And today is the first lecture of rheumatology. And this is this one, and maybe the next one is more about the introduction of rheumatology because I understand you are going to study these conditions for the first time. So there's a lot of basic things which you must understand before starting this rheumatology section. And this is the last unit which we are covering for internal medicine. So, what is rheumatology? Basically, rheumatology originates from a Greek word called as rheuma. Okay, so uh, you can see this one rheumatism first introduced in 1642 when they realized that arthritis could be a systemic disease. Arthritis, right? So now, of course, like they had discovered a lot of abnormal conditions uh, related to the articular, like which are basically uh, due to articular joints, back and muscle issues. So rheuma, from where the word came from, is basically the meaning is flows as a river or stream, or you can say substance that flow. And now, why uh, why they name it like this? Simply because um, in the start, when of course not much things was discovered. So what they found is that all the people who have some joint problems, they have something in the blood, uh, which out of them many things we know today, which are basically antibodies, right? Autoantibodies or many other things. So before, like they don't know, but they just like found some extra things simply. So that's why they call it as like this condition is rheuma condition, like something is flowing in the blood. So nowadays, for example, the British Society of Rheumatology defines rheumatology as a multidisciplinary branch of medicine that deals with the investigation, diagnosis, management of patients with arthritis and other musculoskeletal conditions. And now they incorporate around 200 disorders which affect the joints, bones, muscles, and soft tissues, including inflammatory arthritis and other systemic autoimmune disorders, as well as vasculitis, soft tissue conditions, spinal pain, metabolic bone diseases. All these things they include in this one. So that's why it is over 200 disorders that nowadays rheumatology it deals. So nowadays, of course, because there are different new advances, new discoveries in immunology, uh, as well as different new drugs and different new investigations are also discovered. So uh, nowadays we know much about rheumatology, right? One more thing, again, let me tell you guys, very 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 important thing. um, if you guys don't know much about immunity, maybe this uh, rheumatology again is going to give you a hard time, okay? Because a lot of rheumatology, like immunity or the immune mechanisms are basically play an important role in rheumatology. So first of all, I would like to talk about many basic terms uh, you can see starting from inflammation, which is tissue reaction to injury. It may be acute, as in burn or gout, or chronic. Then what is cartilage? Now, I think like very, very, very easy thing, right? What is cartilage? So we know like it's a connective tissue and it have two types. One is called as hyaline cartilage, which is smooth and gristle, and one is called as fibrocartilage, which are basically found in the knee. So hyaline cartilage is avascular, and to tell you that this one takes its nutrients by diffusion from the synovial fluid, and it have type 2 collagen meshwork. It is made up of that. And now you must know like what are the function of cartilages. Simply, cartilages are those that that give that smooth surface for the joint movement, right? And all the pressure, what you can say, which is given to the joint, is much of that is held by the cartilages. So capsule, see over here, this is bone, this is the cartilage, okay, and this is the capsule, okay. So when it comes to the capsule, it's a thick membrane that joins bone, making up a joint. It also isolates the joint cavity from the surrounding tissue, okay. So simply the joint is enclosed in capsule, okay. Now uh, one thing is anthesis. It's one of my favorite question, by the way. What is anthesis? Because many people, they don't know this thing. It is basically where the ligaments, tendons, and the joint capsule, they attach to the bone. That site is called as anthesis, and whenever the inflammation of that thing will occur, that is called as enthesitis. So the inflammation of the anthesis is called as enthesitis. Tendon. Now, like the thing seems easy, and you know what's there, but whenever you ask that, like someone will ask you what is tendon, so maybe like you cannot explain that thing. So of course, like it's a fibrous tissue, and this is the one which attaches the bone with the muscle, right? Or muscle with the bone. And whenever there is inflammation of this thing, we call it as tendinitis. And whenever the tendon sheath is inflamed, we call it as tenosynovitis. Remember, from synovial membrane. So what is the function of tendons, guys? Tendons or ligaments. Uh, Ligament is simply a band of tough tissue which restrains joint movement, and it confers stability to the joint. Okay. And sprain, like we can get ankle sprain, which is a stretch or sprain of the ligament. So tendons and ligaments, they basically stabilize joints, okay? And ligaments are elastic, whereas tendons are inelastic. So you can say that ligaments can give some laxity to the joints, or you can say freedom of movement, whereas tendons are those which are inelastic and they transmit the muscle power to the bones. And the joint capsule is formed when the fibers from the tendons and the ligaments, they fuse together, and they make what you can say a meshwork, okay? Not a meshwork by the say by the way you can say a wall, okay? Synovium or synovial membrane. So synovium is a thin membrane, normally one cell thick, which is found within the joint capsule. So it produces synovial fluid, okay, which lubricates and nourishes the joint cartilage. And whenever it is inflamed, we call as synovitis. Now this is very, very, very important. Why? Because this thing will come again and again and again. So synovium and synovial fluid. Inside synovium, there is synovial fluid, okay? And it is connected with the periosteum of the bone, and it is smooth, and uh, of course, like its function is to retain the joint fluid inside. There is no, you can say, gaps in that. So simply, and the tendons, they are also lined by the synovium. You can see tendon, they are tenosynovitis, so they are lined by the sinus. Joint effusion. Whenever there's accumulation of the fluid in the joint, we call it as joint effusion. One thing is bursa. Now, bursas are many, there are many important bursas, like there are bursas around the shoulder joint. Again, like we can take the help from the ping and just to show you bursa. See, this is the bursa on the olecranon process, and sometimes it can be inflamed, called as bursitis, right? Bursa. So bursa is basically a fluid-filled sac, and they are always present at the areas where too much force acts, for example, around the knee and around the elbow. And they are lined by synovium and contain synovial fluid. And whenever they are inflamed, we call as bursitis. For example, pre-patellar bursitis, we also call it as housemaid's knee. Why? Because when the housemaids, they kneel on the floor and they clean the floor, so they may have this thing. Okay, now see, monoarthritis. What is monoarthritis? When one of the joint is inflamed. Oligo or polyarthritis, when 2 to 4 joints are inflamed. Polyarthritis, we say when more than 4 joints or groups are inflamed. So these terms, guys, why I'm stressing them a lot on them is simply because these terms will come on again and again in rheumatology, and you must know like what we are talking about. Simply, spondylitis is whenever there is inflammation of the axial vertebra, like the disc and the ligaments, and their related structure, we call as spondylitis. For example, we will cover one condition called as ankylosing spondylitis. To tell you the truth, uh, in our university, they give just 4 hours. No, like in total, they gave 8 hours of lectures about rheumatology. That's it. But I am going to cover all this rheumatology in the next 1 month. Myopathy, the term is easy. It's the abnormality of the muscles or disease of the muscles, and myositis is the inflammation of the muscles. Vasculitis, simply inflammation of the blood vessels. Subluxation. So, what a subluxation is simply when the joint is malaligned. okay, when the joint is malaligned. And dislocation is simply when the articular surfaces, they are not in contact, they are completely displaced, okay, we call it as dislocation. And deformity is a very common term, abnormal shape or size, uh, for example, bony hypertrophy, okay, or malalignment of articular joint, or like any damage, of course, simply any defect which we can appreciate, we call it as deformity, right? And guys, remember this thing, like all the ligaments, periosteum, synovial tissue, and capsule of the joint are richly supplied by the blood vessels and the nerves. And because there are nerves, so the pain from inflammation, okay, pain usually when there is inflammation of these sides, okay, so there is pain which originates from there, right? So um, simply okay, ROM, or range of motion, it is a range of motion of your joint. For example, your elbow, your arm at the elbow joint has like around 30 degree to more than 180 degree of range of movement, right? So all the joints, we must know what are the normal range of movement motion. By because if you don't know the range of motion, the normal one, how you can appreciate the abnormality? Contracture is loss of full movement due to fixed resistance by tonic muscular spasm. Reversible, this is a reversible curve, or fibrosis of the structure which is permanent, right? So there can be many formation of contractures after burns. Again, if you are interested in looking at some contracture, I can show you over here. Contracture. So you can see a contracture, or a contracture in this case. See a contracture over this case. Like of course, like they are showing about the hands, and see there's a contracture over here. There's something called as Dupuytren contracture. There is something called as Waxman contracture. So there are different type of contractures. Now there is something called as rheumatoid factor. So what is rheumatoid factor? Simply when we do a test in rheumatoid arthritis, so we can found RF factor, which is, or RF, rheumatoid factor, RF positive patient. So it is an immunoglobulin directed against the FC portion of IgG. And so there are many people who are seronegative. Seronegative, like in their serum there is nothing, right? Seropositive, like in their serum you can find some positive things, like rheumatoid factor, right? So that's how we say either the disease is serum negative or serum positive, right? So other than that, if you will see nodules, I think, like, okay, what are rheumatoid nodules? We are going to study them later. But what is nodules? I think you know what is nodules. Like, it is subcutaneous soft tissue swelling, and it's very, very, very common. So you can see a nodule. See, it's a nodule. It's a nodule, right? So again, it's a nodule. So something which can be soft, which can be hard, whatever, which sometimes can be attached to the deeper structures. It is like rheumatoid nodules, of course, they occur in rheumatoid arthritis. Arthropathy. What is arthropathy? Whenever there is any joint disorder, we call it as arthropathy. This can be arthritis. So what is arthritis? Simply inflammation of the joint, or which can be arthralgia. What is arthralgia? Joint pain. is called as arthralgia, and what is myalgia? It is muscle pain, right? So these are few terms of in rheumatology, right? So again, arthralgia, arthritis. Okay, yes, one of the thing is active joint. Uh, like maybe you will not find in the books, but active joint means we refer active joint to any joint in which like inflammation is going on. We call it as active joint. Like this is joint which is actively affected. Okay, so because like the joints, they keep on changing, like the joint affected keep on changing in the patient's time to time. So we are going to discuss this thing later. Like this is the normal one, this is degenerative arth joint, and this is inflammatory joint. Of course, like we are going to discuss them later. Okay. In this one, guys, like this is simply a revision of immune mechanism of diseases, and there is given what is the definition of autoimmune diseases. So the diseases which result from failure to discriminate between the self and non-self tissue. Autoimmune condition is simply anything in which the antibodies or autoantibodies started damaging or destroying their own body cells, or taking like they are taking the own body cells as foreign bodies. So of course, like when there is activated immune system against self, there will be cell damage, destruction, or dysfunction. And autoreactive T cells are the most common effectors in these diseases. And I don't know like how much you still remember, but this is very, very, very important. These are the 4 types of immune reactions. Type 1, uh, which is also called as uh, anaphylactic or immediate hypersensitivity. Type 1 is also called as what? Immediate hypersensitivity. So of course, like in this one, there is formation of IgE, and these IgE are the one which release all the mediators from the basophils, from the mast cells, and there is inflammation going on. For example, in asthma, they have a high type 1 hypersensitivity or immediate hypersensitivity or allergic rhinitis, and anaphylaxis is also the example. Type 2 is also called as cytotoxic. What is the difference between type 2 and type 3 is in type 2 there is formation of antibodies, and they bind to the antigen on the cell surface. Okay, they bind to the antigen on the cell surface. For example, autoimmune hemolytic anemia, in that one, remember that the antibodies go and damage the RBCs, so they attach on the membrane of the RBCs. Or for example, in the last nephrology, we had done something called as Gus-Pasteur syndrome. What happens in that one, there is anti-glomerular membrane antibodies which go and attach there. Rheumatic fever also occurs due to this type of cytotoxicity. Type 3, it is also called as immune complex. Now, what is the difference between type 2 and type 3? Because in type 3, there is antigen and antibodies complexes which are circulating in the blood. They are circulating in the blood. And this is what occurs in SLE or systemic lupus erythematosus, or polyarthritis nodosa, which is also called as PAN, or post-streptococcal glomerulonephritis. Like simply the antigens antibody complexes which are circulating in the blood, they will go and they will start damaging the kidneys. And the last type is cell mediated or delayed hypersensitivity, which is also type 4. And simply these are the release of cytokines by synthesized T cells or T cell mediated cytotoxicity. The examples can be contact dermatitis as well as insect venoms, or many other examples are also there. So this is type 4 hypersensitivity reaction. So now again, like I think the last part in this lecture, what I wanted to talk about is this thing. Now, you can say um, pathology, guys, revised pathology. We had done MHC or HLA. MHC is major histocompatibility complex, or HLA is human leukocyte antigen. So what are these? Like, these are simply cell surface molecules. HLA is the cell surface molecules which play a role in mediating immune responses or reactions. And these are like the genes are located on chromosome, basically like the short arm of chromosome number 6, that code for the HLA molecules. Now, why I'm talking about this thing? Because there are some specific, like to give you an example, like all of us have a different genetic makeup. Like maybe I have HLA-B, or maybe I have HLA-DQ, and maybe you have HLA-DB, or maybe you have HLA-C, right? Things like this. So everyone have a different genetic makeup. So now, as you know that MHC type 1, class 1 are molecules are basically located on all cells of the body. Type 2 are basically located on antigen presenting cells like phagocytes or B cells. And type 3 are located in the plasma. And these are the functions of these one. Okay. So these class 1, class 2, and class 3, they play a very important part in mediating the immune reactions. And there are many rheumatic diseases which are more common in certain genetic makeups. For example, the people who have B27, okay, of course B have many types, C have many types, A have many types, okay. So maybe I am HLA-B12 or HLA-B36 or HLA-B-C3, like this, right? So the people who are B27, who like their genetic makeup is like this, like HLA-B27, they are associated with having increased chances of ankylosing spondylitis or reactive arthritis or enteropathic arthritis. DR4 and DR1 are associated with rheumatoid arthritis, and DR3 is associated with Sjogren syndrome or SLE. So that's why, guys, I told you that to study immunity, to know about immunity, is very important. Like especially when you are going to discuss the rheumatological conditions. Okay, so we are going to do a little more introduction in the next video, and then we are going to start some condition. Thank you so much, guys.